Good morning. This is Dustin Reno, nurse practitioner with Pocatello Wellness Clinic. I wanted to kind of spend some time with you today and talk about a really cool modality for healthcare that a lot of practices are offering to their members, to their patients, especially with everything going on right now with our current pandemic. There is a field of medicine that is very beneficial. If you live in rural areas or have limited access to healthcare providers, there is an opportunity for patients to engage in telehealth. So what is telehealth? Well, as the name implies, it is the delivery of medical care via technology. That communication takes place using things like laptops, desktop computers, smartphones, and it kind of bridges that gap between the rural person and the medical clinic. And especially in a time like now where we're practicing social distancing, this can be a very beneficial thing. Telehealth allows for long distance patient and clinical contact, care, advice, recommendations, education, intervention, and monitoring. So what types of services can be offered with telehealth? Well, there's quite a range, actually. There's services ranging from everything from allergies to arthritic pain to asthma, bronchitis, colds and flu, diarrhea, infections, insect bites, pharyngitis, conjunctivitis, rashes, respiratory issues, sinusitis, so sinus infections, skin infections, cellulitis, sore throats, bladder infections, urinary tract infections, vomiting, nausea. Or you can cover a vast array of medical conditions that can be safely performed via telehealth. Now, with that being said, if there is a condition that is emergent or even urgent that requires a person to be seen face to face for a more accurate diagnostic workup, then you will be referred by that provider to see someone, to go to your nearest urgent care, because despite all of the benefits of telehealth, it can be limiting in the sense that there's no hands-on contact, and a lot of medical conditions are best assessed and diagnosed in person. So does the AAIA offer telehealth services to their members? Yes, they do. They actually offer it at no cost to the member. And what is pretty amazing is they have a 24-hour service for their members for telehealth. The two providers that are engaged in that service are myself, Dustin Reno with Pocatello Wellness Clinic, as well as Velma Seabolt at Wellness Associates. You can contact either one of us, again, 24 hours a day. We ask that you give us up to 2 hours to return your phone call. But when you do call, if you can give us your chief complaint or your concern, what you're calling about, your name, contact information, as well as the nearest pharmacy to you, so that in the event we determine that there is need for medication, we can call in those necessary meds. So it's an amazing service provided by the AAIA, especially, as I mentioned before, during this time when we're trying to engage in social distancing and avoiding large crowds. Or if you live out in a rural area and you're having difficult time getting into your provider because of work or other obligations, it's a great service.